Hi, my name is Tiffany, and today I'll be presenting my first complex case. This patient is a 69-year-old African American male whose chief complaint is lightheadedness for 2 days. He states that 2 days ago he woke up feeling lightheaded and stayed in bed all day. The next day he gradually felt better and got out of bed and continued with his daily activities. He states that when standing, he felt, quote, unsteady on his feet, but denies any recent falls, no difficulty talking or walking, and no difficulty with coordination. He does report feeling fatigued, and he could also occasionally feel his heart beating in his chest. He denies any aggravating or alleviating factors related to the palpitations. The patient also denies any chest pain, no shortness of breath, nausea, vomiting, fever, or chills. He also denies any change in vision, headache, tinnitus, change in bowel or bladder habits, or any change in diet or fluid intake. So his past medical history includes hypertension, systolic heart failure, hyperlipidemia, atrial flutter, and carpal tunnel syndrome. His current medications include metoprolol 25 milligrams BID, Lasix 20 milligrams Q-day, atorvastatin 20 milligrams QHS, gabapentin 300 milligrams BID, and he denies any food or drug allergies. He also denies any childhood illnesses. His only hospitalization was in 2014 for atrial flutter, and at that time he also received a cardiac ablation. He denies any other surgical history. Family history: his father is deceased from an MI. Mother is also deceased from CVA. He has one brother who is living, and he has heart disease and diabetes. The patient is married and lives with his wife. His occupation is retired. He denies any smoking, alcohol, or drug use. He did receive a colonoscopy in 2011, which was normal. His review of systems: he states that he feels fair overall. He does report fatigue for the last 3 days. He denies any fever or chills. Respirations: he denies any shortness of breath, cough, or nocturnal dyspnea. Cardiovascular: denies any chest pain, shortness of breath. He sleeps on one pillow at night, but he does state that he can, quote, I can feel my heart beating in my chest. GI: he denies any nausea, vomiting, or diarrhea, reports a good appetite. GU: denies any difficulty urinating. Musculoskeletal: he denies any joint pain or swelling and denies any gait problems. Neuro: denies any memory loss. He does report intermittent numbness to his fingers due to the carpal tunnel, but this is a chronic condition. Skin: denies any rashes or lesions. Psych: he denies any changes in mood or sleep habits. Objective information: he weighs 65 kilograms, BMI is 28, temp is 98.5, pulse is 68, respirations 18, O2 saturation 97% on room air, and his blood pressure is 120/82. He appears well groomed and in no acute distress. He's oriented to time, place, and person. Skin is warm, dry, and intact with good turgor. Head, eyes, ears, nose, and throat are all normal. Neck has no JVD, no lymphadenopathy, and no thyromegaly. Chest: the respirations are even and unlabored. Lungs are clear to auscultation in all fields. Cardiovascular: he has a regular rate and rhythm on auscultation and no murmurs or rubs noted. GI: abdomen is soft and non-tender. Bowel sounds present in all 4 quadrants. Musculoskeletal: his gait is steady with normal strength, tone, and range of motion. Extremities are all within normal limits. No edema was noted, and peripheral pulses are palpable. And neurologically, he has no gross neurological deficits. So an EKG was done on this patient in the office on the same day. So I posted an example of the EKG in the reply box below, so you can take a look at that. And then let me know if you have any other questions, and I look forward to hearing your plans. Thank you.